This is Maska Sadris, a 35-year-old mother of 9 living in Wera, Kasese district. Maska did not intend to give birth to these many children, but found herself doing so, partly as a result of limited access to basic information on family planning. Maska's husband was equally unsensitized on family planning matters. It was not after the 9th child that Maska finally found out more about family planning from her peers.
Namayo waba namanda and namadisha ngara kwa bandizini shetukeriba so mesi neriba mbali neriba kulia chala kana fongo ngayo wa mafongwa nganandreka kaningana utramani kana mukole mibiri ya isinga utahakaluma.
Uganda has one of the highest birth rates the world over, with an average of 7 children per woman. This implies that Maska's case is not unusual. The year 2009 ushered in a new wave when Strides for Family Health started operating in the districts of Bujiri, Kumi, Kamuli, Kaliro, Mayuge, Kayunga, Luwero, Nakasongola, Mitiana, Sembabule, Kalangala, Mpiji, Kasese, Chenjojo and Kamwenge, supporting the provision of integrated reproductive health, family planning, child survival and nutrition services.
The aim of the project is to support the Ministry of Health to reduce high fertility rates and reduce maternal and child mortality and morbidity in the 15 districts where we are operating.
With the aim of improving the quality and access to integrated reproductive health and family planning services, Strides for Family Health engaged a multifaceted intervention approach.
The first strategy is fully functional service delivery system. And by this we mean that at all service delivery points, there are basic standards that have been determined by Ministry of Health and which we would want to make sure that these standards are available. The second strategy is strengthening leadership and management skills right from the district level to the service delivery points. The last one is where we engage, particularly the private sector, what we call performance-based contracting. And through this, whatever these contractors contribute to, we'll be able to help to improve the performance of the project.
A lot of emphasis was put on antenatal care and delivery at health facilities, better nutrition for children, and the involvement of both the husband and wife in embracing family planning.
Kandi norura hati ebyokulya n'obirura bintu bikaleta obuzibu. Nyencha nozara na buli nogarukamu eningonza tugarukiraho osobole kurura abana bawo bikale kurungi kotungire nukono bali.
Strides for Family Health is a 5-year project funded by USAID and managed by Management Sciences for Health together with its co-partners Communication for Development Foundation Uganda, Japaigo and Meridian Group International. Strides for Family Health has been working in partnership with the Ministry of Health and district officials to ensure that this widespread intervention trickles down to the key beneficiaries, especially at the village level.
Through this support, we managed as a country to register improvement in family planning, contraceptive prevalence rate. We managed to improve within 5 years, between 2005 and 2011, from 24% to 30%. At the same time, we registered an increase in facility delivery. We increased to 57% facility delivery, and also the mothers that were delivering under skilled care, the figure went up to 59%. So this was through a close partnership, through the public-private partnership with Strides.
They helped us to initiate or to rejuvenate community initiatives like villages teams. They helped us to train villages teams. But as of now, we have a coverage of 38% villages teams in the district.
The number of mothers attending antenatal care facilities, especially the 4th one, have gone up. The number of mothers delivering at a skilled birth attendant have also gone up. And the dropout rates for some of the vaccines like DPT has also dropped. And the BCG uptake has gone up. I'm just saying this because as Ministry of Health, we have a general league table where all these indicators are highlighted. And for me as a district health officer, that's one of the tools that I use. So since 2009, Kamuli district has come up from position 79 to position 29 to position 17.
The relationship we've had with the Ministry of Health, we are represented in all the technical working groups, the nutrition working group, the maternal and child health cluster, and the quality improvement working groups. Here we are able to influence policy, we are able to disseminate and share the Government of Uganda Ministry of Health policies and strategies at district level.
One of the best practices that Strides for Family Health has promoted widely is the use of the pattograph to monitor labor. A pattograph is a monitoring tool that allows trained birth attendants to monitor the progress of labor and to have clear means of tracking whether labor is obstructed.
A pattograph is a tool used to monitor the condition of the mother in labor and what has been done to the mother. If the mother is well monitored on the pattograph, she can get a normal delivery, a live baby, and whatever incidence comes, we can detect early.
We are focusing on promoting the pattograph. The pattograph is WHO best practice. It has really made us achieve a number of things in regard to reducing maternal mortality at facility level.
In order to increase access and use of family planning, Strides for Family Health promoted the mini laparatory procedure in various districts. Midwives and clinical officers in the districts of Kasese and Mityana have been trained to carry out mini laparotomy procedures under local anesthesia. A case in point is Wera Hospital in Kasese, whose clinical officers had conducted 15 mini laparatory surgeries by November 2012.
Akoba namunane nana befungwa. Ingafungwa mungalwala. Bana belwala. Nena makolonga na badokita bebwera. Nero bamanyifunga. Ngayo wamufungwa ngana utubuholo. Nabana ngetukiri basomesya ndreke. Ngana langira. Etuli kwa jitsibu chenzala. Isanga tokera balemera. Kenga namubuta. Nero munga nayo namabuta bungaho. Changana nyitungira buholo.
Nero omwami akikumira mu mayinga ngana mukolesha akakinzo kamezi yayi asatu. Iningana nzo almost 1 year. Isina tendo ku menstruation. Kandi obutukubwa iyanyi bohola ingambala. Kandi ngangabiri ambala kandi ngatusamba ingasenda kwangezo. Kandi yanyi college. Kandi yanyiribu kandi ngonze nemyakibiri ngana onza isina tambala. Inga umsirizya.
Postpartum intrauterine device, IUD, is another long-acting family planning method that Strides for Family Health promoted with great success. The method is currently being sought by couples in remote areas who lacked access to such services before the intervention of Strides for Family Health.
We insert copper T 380A in mothers who have just delivered. We offer postpartum family planning. It's now beginning immediate after delivery.
Bwenamala okuzala n'akanteekamu. Naye kale kati okuva olwo sirina buzibu nkafunyeemu.
Kenasobola okwanguyirako. Kubako kaba kasobola okukola ki bw'oba otuusizza okwagala okuzaala. Ddayo ne bakakugyamu. Kale ng'ate era si byakumpisa bubi.
Turn-up yaffe nnungi nnyo. Baluli twabalifaringanga mu theatre. Ddala bano abakyala ba IUD ne implant nga tetuzimanyi ziteekamu naye kati tusobola ozikola ki oziteekamu.
The entry point to improving maternal service is delaying what? Another pregnancy. If we delay another pregnancy, so we delay another complication.
To ensure that implementing districts have enough services, Strides for Family Health awarded over 50 contracts to private and public service providers in what has become one of the project's key best practices. Strides for Family Health has improved access and utilization of maternal health, child survival, and family planning services in all the 15 implementing districts. Mayuge District has since stepped up its service provision to include outreach programs under the contractor Subi Medical Center.
When Strides came in, we maintained our laboratory services, general diagnostics, and medical treatment. Then we also included in family planning. We had to include in deliveries. We had to include in also immunization, not only at the facility, but also in outreaches.
In Mpigi District, the Ernest Cook Ultrasound Research and Education Institute, ECUREI, has trained health workers and midwives in the use of ultrasound services in 12 health facilities.
We wanted to improve the skills, the clinical skills of the midwives catering for these mothers by equipping them with ultrasound skills and also giving them ultrasound equipment and then deploying them to these health facilities so that they can incorporate ultrasound scanning into routine antenatal care.
This intervention has seen a remarkable increase in antenatal attendance to 141%. Unlike what the situation was before, the use of the ultrasound services in the districts of Mpigi and Chenjojo has seen expectant mothers now go for the 4 required antenatal visits before delivery.
The antenatal clinic attendances have increased from the previous ones, and also the deliveries have also increased. The range was between 400 to 500, but now the range is 700 to 850 there. And also the deliveries, before they were ranging to 80 to 100, but with the scan, the deliveries are ranging between 150 to 180.
We get more who are coming in. Very few are now going to the traditional birth attendants, and they opt to come to the facility. And this has actually been realized in the numbers we're getting at the facility.
The additional ultrasound scanning services really caused excitement in the community. Women wanted to come and see the image of the baby, to know if the baby is well positioned. And it just, for anyone who has been a mother, it's exciting to see the image.
Nze bwe najja wano mnatoka ne batugamba scan. Nengamba ha scan kya mugaso nnyo. Bakuyamba n'obeera nga tebakunyiga lubuto. Kuba edda baali banyiga nnyo n'oba ng'owulira obulumi. Naye kati bateekako obutesi n'olaba omwana wo n'ogamba ha mpulira bulungi. Kati ogenda okwetegereza ng'olaba omwana wo ne bagamba ha omwana wo mulamu. N'osanyuka nga omwana wange mulamu.
We used to have very few mothers attending the 4th visits because they would only go there to get a card because they knew without a card it is hard to deliver from a health setting. But currently the 4th visits have increased. Even we have those 5th and 6th visits, so people have liked.
Subsequently, when they come, we realize that the rapport they've built with the health workers helps them to even get better health outcomes. And the 4th visit, that means someone, by the time they come to this visit, they've acquired a lot of information and they've built enough rapport, and they just think that they should deliver at the health facility. So most likely, they'll deliver at the facility compared to someone who just came once for their antenatal passport card and disappeared, just waiting to come to the facility.
Kati natuuka nenfuna olubuto. Bwe nfuna olubuto ne neeyambisa sikaani. Kati sikaani ne kizula nti sijja kusobola kuzaala buzaazi. Balina okunnongoosa. Kati bwe natuuka okunnongoosa, bannongoosa. Era ne nvaayo bulungi mu theatre. Naye ne nfuna pain nga y'amaanyi nnyo sayidi emu. Kati ne ngamba abasawo, nnumizibwa nnyo nnyo. Ne bangamba ati kiyina buzibu, weebakire sayidi gy'oyagala, gy'otolumizibwa. Ne mbagamba bannongoosaako dda naye nga mpulira bubi. Kati omusawo wa sikaani n'ajja. N'akuuma ako akakebera sikaani. Ne mugamba musawo, nyamba onkebereko. Kati omusawo oyo n'ankebera. Bwe yankebera n'akizuula nti munda muli. mulimu ekyende ekyali kitadde ng'omusaayi gukoze internal bleeding. Yadduka mangu n'alaba dokita. Dokita bwe yajja naye n'akozesa obwangu n'anzizaayo mangu mu theatre n'asiba mangu ekyende ekyo kyali kireese omusaayi ne baguyolamu n'enkomawo mu woodi we nali. Kati n'enkizuula nti singa teyali sikaani saaliwonye era saalibaddewo.
Currently, the males have been motivated to come into because we give them even a special advantage. Coming with your husband, you're served first. So it encourages the mothers to keep pressing their husbands to come because it enables them to go home very fast, earlier than the others. In cases of problems, it is very hard to maneuver when the husband is not involved. Yeah, so it is very, very important to have the men involved in the system.
In the same measure, the number of mothers delivering at the health centers has gone up alongside improved care at the health facilities. In Kyenjojo district, southwestern Uganda, the contractor Midas Touch uses a voucher system to enable mothers access free ultrasound scan and maternal child health services in 11 government health facilities.
They are received and registered under the project and given a blue voucher, informing the mother that she is part of our project. If she attends the 4 visits, she will get a green voucher, entitles her to a free ultrasound scan, and it also entitles her to emergency obstetric care.
Karabibwa kubi kigambo kya sente akwanga bandi kyaka onka bandi kyaka kale nku kusente zizali nziburabura kale ati kutwaliza hamu ekitongole kimi kiyambire muno nyo kinyambire nku omuntu abo kwanga twalinda yange nkagitwara kurungi bire bizibwe binarabiremwe kabera bamu mu buzibu mu kunyigirizibwa cyonka tenendo nagitwaire nahura kale tindi kurungi ni kara muno ne sasa bambi aliyo omunasa mwetariete akanyamba muno yangambo mahicyo bokora ija mu TV namugamba buli nkajamu kibanja hausente masoko nya hausente yangamba mine bintu otukuja kusasula na kikumi.
Kalangala is one of the hard-to-reach areas because of its geographical location on an island. St. Philomena Clinic, the private contractor at Kasekulo landing site, has increased access to family planning and improved maternal child health services on the island.
The subject I'm carrying out family planning. It wasn't there before. I reached here when people are delivering like these birds because they were delivering even on the streets. In the latrines, abortions were many. So women who were pregnant were not attending to me. I was just calling them from notice. And now mothers are not getting problems as before because I try to take early and refer serious cases to hospital and treating minor cases and also selecting for maternity delivery here.
Before its partnership with Strides for Family Health, St. Philomena, the only health center on the landing site, operated in a ramshackled wooden structure that leaked whenever it rained. To date, the newly renovated clinic is part of the success story of the Strides for Family Health project and has become an oasis for women seeking family planning and maternal child health services on the island.
Nze najja muno 2007 najja ndi lubuto naye nga eddagala ebiseera ebyo eryokumbi twalifunanga mugoye health center naye okuva lwe yasembe twazula nti ali wano n'eddagala libeerawo kitwalira akabanga okugendako mu ddwaliro eddala eddene era obujjanjabi obusookera ddala tubufuna wano.
Kya family planning kyondooza kikoze bulungi nnyo lw'okuba wano abakazi abaliwo abasinga si bafumbo nnyo be bano okusanze kasekulo so oyinza abadde afuna embuto nga tebeeyagalidde olw'ensonga bawulira family planning akamuli ka kyenvu naye kiba kiri wala okutambula
bw'onodduka ku musajja wo ojja musaba ssente ajja zikuwa ogende e Masaka oba ogende e Kalangala.
But Feast is a academy tusoma ekituufu kyo omujjuzo gw'obwana kuba oli abasajja twali tumanyi okumukola ki okuzaala nti lwoba omusajja naye kati bw'ojja okiraba alabamu nti ozaala bangi nga bajja kulemerera kuki ku bintu ebikwatagana n'okwebika okulya n'okusoma.
Through the performance-based contracting, contractors have learned, first of all, they have been taught financial skills and also proposal writing skills, and some of them, like Sobi, they are working with the donors for the first time. So we believe we are leaving them at a different level now.
Strides intervention pushed us on form. It brought us back on form. We're in position to get training in family planning, and at least we have a better view of family planning. We can now conduct family planning, and at least we are trying our level best to reach out to the people with the family planning methods.
Ganzaire ku mwana asooka n'abaako ku Makerenda n'abona nga gankolera bulungi. Buti ow'okuna wa myaka 4 kale buti n'akomaawo nga nenda nkola ki nsomeseeko abume mali.
Strides for Family Health emphasizes child survival to counter the child mortality rate, which currently stands at 90 deaths for every 1,000 live births for children under 5 in Uganda. In implementing the minimum package for child survival services, Strides for Family Health came up with a number of innovative, affordable and sustainable approaches, including the use of the positive deviance hearth.
We look for those families with the positive practices, for example, in family planning, for example, child care, for example, health-seeking practices, and maybe sanitation and the environment practices. Those good practices the families are conducting within their families. So by choosing those families, we need all the family members within that community to go and learn the best practices within that family.
After sensitizing the sub-county leaders, we went further down and we visited homes and we carried out PDI inquiry, and we found these marginalized children whom we registered at Nawaikoke Health Center 3.
PD Health session is a 12 days series of sessions, because we arrange those days from day 1 up to day 12. They receive a training from light caregiver with the help from the VHT of that village and the health workers within that community. After conducting for 6 days, then the 7th day, these mothers with malnourished children, they go home on that 7th day and they practice what they have been told within the 6 days. Also weighing, it is an activity which we conduct. We weigh these malnourished children on the 1st day, we weigh them on the 8th day, and we weigh them on the 12th day to check whether they are improving or they are not improving. Because after the 12th days, we are supposed to graduate them.
Abakyala bahanu ya kyalo n'abashomesa enaku 12. Ngeri nindeeba obuhame nyineho bamwe abaabire bubapimire bakashanga za kilo zabo zigwire konka mu naku 12 nkashanga za kilo zabo zayeyonjire.
At first, when this boy was malnourished, he had 5 kilograms. But as for now, today, we measured him. He's now 9.9 kilograms.
This approach, we liked it very much, being that it is sustainable, community utilizing their resources to prevent malnutrition and even rehabilitate those children within their community.
abasitraidi abaleta omusomo guno ogw'ebyendiza ey'abaana.
Strides for Family Health also conducted integrated outreaches and Child Days Plus, a Ministry of Health strategy for delivering an integrated package of key health child survival interventions such as routine immunization and vitamin A supplementation.
Under the immunization program, which falls under child survival, we focus on supporting the 588 public and private health facilities to offer routine immunization of children under 5, but we also work with the village health teams to mobilize these children and refer them to the health facility.
It was our intervention with Strides that helped to play a big role when we had a measles outbreak. Vitamin A supplements help a lot in measles because they boost the immunity of the body of the children, so the children try to resist the measles.
Whenever we go for screening for malnutrition, we go with vitamin A. And every child who is supposed to get vitamin A, we give. We give even other immunizations.
Strides for Family Health has built strong and sustainable community ties through a network of trained community volunteers, popularly known as village health teams, who have encouraged access to family planning, child survival, nutrition and maternal health services.
Tutulanga bwe tuli bana batulunda nga tuli bana ku kyalo ffe ne tutuula ne tugamba nti bw'ogenda kukola ku family planning bw'ojja kusomesa ku kintu kano bw'ojja kusomesa ku kugema abaana bw'ojja kusomesa ku kino oluvannyuma ffe ne tugenda netwegaba ebirala omuntu agenda eno omulala n'agenda eno n'agenda.
There are some parishes which are far to the facility, so those ones what we do, we can tell those VHTs to mobilize mothers and they get in the area or in place, they get a house, a room, a school, and we have a mobile scan. We take that mobile scan there and we work on those mothers from there so that those mothers can also get used to those health medical workers who have gone there, and they can also get interest to come at the facility.
The Strides for Family Health project has left a positive impact in the communities of operation, with the latest demographic and health survey reports indicating an improvement in the number of family planning, maternal health and child health indicators.
For sustainability purposes, I think we are on the right track. The districts are on board. We have shared our draft sustainability plan, and the districts have been able to pull out those indicators that they will continue tracking even after the project has been completed.
This is an established institution of service delivery, the government and the local government and the hospital, the rest facilities are in place. So we shall continue providing these services as have been doing before.
Additionally, the district health team is being mentored to monitor the project efficiently after we have left. So during our monitoring visits, we go out with some members of the DHT.
Looking at Kumi, Kumi being one of our districts that we work in, we have had interventions in as much as building the skills of service providers. We know that when we build the skills of service providers, these service providers are able to provide these services even when Strides has phased out.
But on top of that, there are also issues to do with the training of the staff, the health education in the community, the equipping of health facilities, which will last even beyond the end of this project.
Because they trained health workers in long-term acting family planning methods. I think that one, if given the supplies by NMS, that one can do what? That one can continue.
I thank you very much for the care of the, you know it very well. I can't say for everything you are giving me, the knowledge, even the nursing care I'm doing, the method I'm using, you are the one who gave me, who put me even to be known in the whole world. This is a challenge because even when they met me there at the bank, they say, how come that now great you are in the bank? If somebody was in the timber wood.
There is no doubt that there will be continuity beyond 2014, since Strides for Family Health will leave behind a more competent team of clinical officers and better sensitized communities in the 15 districts of operation.
Banange twebaza oyo mwami waiswa